In today's session, we'll be talking about obesity and mental health. So these two are two interconnected aspects of overall well-being that significantly influence each other. And the link between them it is complex indeed, and several factors contribute to this relationship. So, in this session, we'll be exploring how obesity affects mental health and vice versa, shedding light on the importance of addressing both issues together. Obesity characterized by excessive body fat accumulation has become a global health concern in recent years. And on the other hand, mental health encompasses emotional, psychological, and social well being, impacting how we think, how we feel, and how we behave. So, the relationship between these two areas is dynamic, and their interplay can lead to a cycle of negative effects. So the first one I'll be talking about would be body and mind connection. So physical and mental health are not isolated entities, as I said already, but rather a unified system that constantly communicates with each other. And this connection is evident in quite a few aspects of our daily life. So, for example, when we experience physical pain or discomfort, it often affects our mental health state, right? Leading to feelings of irritation or frustration. So, yeah, when an individual struggles with the obesity, the body experience changes that can influence mental well being. So, for instance, the release of a certain hormone in obese individuals may affect mood regulation, leading to symptoms of anxiety and depression. And apart from that, the social stigmatization and negative body image related to obesity can cause emotional distress and further impact mental health. The second one would be talking about obesity's impact on mental health. So, emotions play a powerful role in shaping our physical experiences, of course. So, positive emotions such as joy and happiness can lead to release of endorphins and other feel good chemicals in the brain, thus promoting relaxation and reducing stress. But on the other hand, negative emotions like anger, fear, sadness, they trigger the release of stress hormones, which can have adverse effects on our body, such as increased heart rate and elevated blood pressure. And so obesity can significantly contribute to mental health challenges. So many of these individuals face discrimination and bias, leading to lower self-esteem and feelings of isolation. And the stress caused by society and its judgment and the struggle to lose weight can actually impact on the mental health conditions of the individual, such as depression and anxiety, as I mentioned before. And so, moreover, obesity-related health problems like sleep, anemia, or diabetes can also impact your mental well-being, and in a negative way, of course, because it could reduce overall quality of life. And the third aspect we were talking about is mental health's influence on obesity. So maintaining good physical health it's vital for a positive mental state. So, for example, having a balanced diet that provides essential nutrients can support brain functions and cognitive stability as well. So, by doing this, you have a positive influence on your mental well-being. And on the other hand, mental issues can contribute to obesity. So, emotional distress, often experiencing conditions like depression, they can lead to comfort eating and increase intake of unhealthy foods. And also, individuals with mental health challenges may struggle with motivation and find it challenging to engage in physical activity as well. and this can lead to a sedentary lifestyle and weight gain. And third topic we'll be talking about would be so how to break the cycle. So breaking the cycle of obesity and mental issues requires, of course, a holistic approach, and it has to address both aspects. So this involves implementing strategies to promote physical health while also supporting mental well-being, of course. So the first step would be to have a healthy lifestyle. So we should promote a healthy lifestyle with regular physical activity and as well as a balanced diet, because it is vital in managing obesity and supporting mental health. So by engaging in exercise, we release endorphins, so the so-called feel good hormones, this helping combat the stress, anxiety, and depression as well. Second point would be the mental health support. So providing adequate mental health support, it's essential, is vital in managing obesity related mental health challenges. So counseling, therapy, or support groups can help individuals to cope with emotional struggles and address any underlying issues contributing to obesity. And topic, the third step would be reducing stigma. So reducing societal stigma around obesity is vital as well for improving mental health outcomes. So we should educate communities about the complexities of obesity as well as promoting body pos- positivity, because it can create a more inclusive and supportive environment for individuals struggling with weight issues. So yes, in conclusion, I would just like to add that the relationship between obesity and mental health it's a complex and bi-directional one, as I already mentioned, and that obesity can impact mental well-being, while mental health issues can contribute to obesity as well. And breaking this cycle requires a comprehensive approach that addresses both physical health and mental well-being. And by promoting healthy lifestyles, providing mental health supports, and reducing stigma, we believe we can improve the overall health and quality of life of individuals facing the challenges of obesity and mental health issues. Taking care of our bodies and mind as a whole is essential, is vital for leading a fulfilling and balanced life.